Don't pay taxes. 3 ways. You can't do that on any other retirement account. Hey, I'm Rebecca. Thanks for joining me on the Mama Lorian Way, where I'm looking to empower you to feel more confident about your personal finances. But first, if you like what we're doing, please hit that subscribe button, press like, leave a comment, support the channel. Really appreciate it. Today, we're talking about, so exciting, health savings accounts. The lowdown. What is a health savings account? What is it? Well, you might guess from the name, it's a savings account that you use to pay for health care. Why wouldn't I just put money into a regular savings account and use it to spend for contact lenses or doctor appointments or whatever? But it's better. Mostly revolves around this thing of a triple tax advantage, and we're going to talk about that later and get more into it. Not only that, you can invest the money that you put into an HSA for better returns than you would get in a regular savings account, which right now I think you're getting like 0.00001, maybe a little less. And it's a good account for younger individuals to save because they're healthy and probably not paying too much for healthcare stuff, and for older people for additional tax savings in a retirement account. Can I sign up? Am I eligible? And this is a nut that my husband and I have been trying to crack. And to be completely transparent, we haven't done that yet. I don't have a health savings account because we're not eligible. However, if you have a high deductible health plan, meaning high deductible health insurance plan, and I'll talk about what the IRS in particular considers it. You are between ages 18 and 65, you're not on Medicare, and no one can claim you as a dependent, then you might be eligible. This is a chart I got from a website, shrg.org, high deductible health plan, minimal deductible. So for an individual, one person, $1,400 annually is a minimal deductible. And what that means is you're going to have to pay as an individual, single person, $1,400 in medical expenses before any insurance will kick in. For a family, you would have to pay for everybody in your family a combo of $2,800 for any insurance to kick in. And they usually kick in at about 80%. So this next thing, the maximum out-of-pocket amounts, including the deductibles, co-payments, anything else that you may have flat out paid for. The maximum you can pay until 100% of your health care costs are paid by your insurance. For a single person, $7,000, and for a family, $14,000. How much could I put in to my health savings account? I'm going to go back to that slide. Your contribution limit per year, and it can be a combo of your employer putting some in for you, whatever, however it looks. Individually, you can put $3,600 in as of 2021. For a family, max amount $7,200, 2021. And if you're 55 or older, whether you're single or in a family, you can add $1,000 to that. So either 4,600 or 8,200. You may be asking yourself, I still don't know why I would benefit doing this, said everyone the first time they hear this. I think I had to hear it at least 5 times and maybe 6. It's taxes. Taxes are the biggest thing. 3 ways that you save on taxes are basically tax-free. First, tax-free to contribute from a payroll, or if you're self-employed, a tax deduction. So what that means, if you have a gross pay of $1,000, you could take $100 of that, put it in the HSA, and only pay taxes on that $900. It's tax-free from the top. Number 2, tax-free on the interest and on any gain. So while that money is in the account and making interest, or perhaps you put it in an index fund and it's getting dividends, however you're making investments, all of that is tax-free. Then number 3, when you take it out for health expenses, for medical, for qualified medical expenses, that's tax-free too. You can't do that with any other retirement account. You're either paying taxes on the front, which is a Roth, and then you put it into your retirement account and you don't pay taxes on anything that you gain when you take it out, Or you get a tax benefit before you put into a traditional IRA, but paying taxes on the way out. This way, you're not paying taxes on the way in, on the way up, or the way out, as long as it's for medical. This is what it looks like. In an HSA, let's say in 1 year, you put in $3,600 right off the top of your salary. If you had a regular savings account, that $3,600 that you want to put in is going to be taxed. And at 20%, just to make easy math, that leaves you with $2,880. Let's say on that $3,600, you earn 10%, easy math, $360 for a total of the year, $3,960 that you could use on healthcare expenses and not pay any tax. Go back over to your regular savings account. You've already been taxed, so you have less money. That same 10%, keep it even, is going to be taxed. So it's not going to be $288. With the tax taken out, it's $230. And again, I'm assuming certain things on taxes. Adding $2,880 to $230, you get $3,100. So you can see you're already about $850 under if you were going a regular account. So if you compounded that over years, it would be thousands of dollars. Bonus for healthy and younger people is you may not need to take out any for medical expenses, maybe $100 here and there. Maybe just pay for that out of your pocket and not take it out. And it can continue to compound for your older self that might need it a little bit more than that Band-Aid when you cut yourself, right? So what is eligible for these expenses? Saying, you know what, I actually do want to take it out of my account. What is eligible? I found this great little list. It's hsalist.org. It's a free little site. I think it's just put up by a husband and wife. All the things that are eligible or not. Acupressure down here. Maybe if you have a letter of medical necessity. Acupuncture, maybe. Adult diapers, sunscreen, alcohol treatment programs, ambulance care. The list goes on and on and on and on. They're adding more to it. And if you could get something like a massage that's under a medical necessity from a letter from a doctor, that could be paid for too. So the next question, you may be going, well, where am I earning 10% in a savings account? Because I haven't found that. And you are right, my friends. You are right. You don't. But you can use your health savings account to invest in, for example, real estate. Maybe you bundle a few people's HSAs, like all your kids' HSAs, if they're all over 18, bundle it together and you guys buy a rental property. It can collect the rents over the time, and then say at some point you sell that property, split the proceeds, and now that HSA has a little bundle that you can use to spend for healthcare for when you're older. Private lending loans, you can bundle smaller accounts in order to make enough money to lend out to private lending, and sometimes a custodian, the company that's holding on to your HSA, can help you with these things. Index funds, I don't really do a lot in the stock market. I think index funds might be better. And big disclaimer, I am not a professional, just giving you some education so you can start to think about these things. Good thing with index funds is a lot lower fees. I have found with mutual funds, at some point, because of fees and expenses, I was making 1.4% with money in a mutual fund. 1.4%. That's not even inflation. I promptly took it out and invested it in different places once I did those numbers. And here is a word about investing small amounts. With HSAs, you can bundle them up, several HSAs to make a bigger amount. And you may want to also go for investments that can compound quicker. What does that mean? For example, say you have $10,000 in an account and you loan it out 10%. When you get everything back and now you have $11,000, you want to be able to have a short-term loan, maybe the 12 months. So after 12 months, now you have $11,000 and you can loan that out, and then it compounds rather than having it in a long-term investment that's not paying you out. And then also, for example, index funds that pay dividends that reinvest. So your money's there getting dividends, adding up, and then that is reinvested. It's compounding. Definitely something to think about, whether you have $1,000 or $100,000 in an account. HSA custodian. So these are the companies that hold the accounts, and there's definitely differences the amount of hands-on or the amount of education and the amount of fees. Now, we have a lot of our self-directed IRAs in Quest Trust because they do a lot of education. They handle our investments very well. But there are definite fees. So there is a site, Lively, I think it's Lively Me, I'll put it in the comments below, livelyme.com, and it's less than 1% in fees. I think it's more like 0.05% of the amount in your account that they take. Be aware of the fees. Now the downsides. You do have to use the money in this HSA for medical and health expenses, as we looked at before, or you will be taxed on the income that you receive. Plus, if you're under 65, you will be hit with, right now, it's a 20% penalty for early withdrawal. Ooh, ouch. But after age 65, so if you're older than 65, you can withdraw for anything you want. You want to go on a trip, you want to get an RV, you can withdraw without that penalty. So it becomes like a more traditional IRA, and it's totally tax-free for medical expenses. It taxes income for other expenses, tax-free for medical expenses. It's kind of like having an extra something in your pocket for your medical expenses when you get a little bit older, and not having the penalty that you would if you took it out when you were younger, so it behaves like a traditional IRA. It's a nice little augmentation. Not a financial advisor, just giving you some info. I want to thank you for joining me and really acknowledge yourself for educating yourself about finances. Not everyone does it. Probably everyone should do it. Thanks. I'm Rebecca. Hit like, hit subscribe. I will see you soon.